simple and effective ways to improve ergonomics at the operating room and office, including a new microscope accessory. We have no financial interest in this presentation. 5 million years ago, our ancestors became bipeds, and 2.6 million years ago, they began utilizing stone tools. This transformative shift came at a cost in terms of our physical well-being. Ophthalmologists face a particular vulnerability to develop work-related musculoskeletal disorders, WMSDs. Early recognition of this will benefit our health and professional longevity. But WMSDs are often neglected by ophthalmologists despite their prevalence. Ergonomics, which aims to design the work environment around the worker, can help with this issue. WMSDs are defined as injuries or disorders of the muscles, nerves, tendons, joints, cartilage, and spinal discs that are significantly influenced by the work environment. They reach numbers as high as 81% in ophthalmologists. Risk factors include static loading, repetitive movements, and non-neutral positions. In the OR, trunk and cervical angles are often inadequate and static, which can lead to WMSDs. This picture, sourced from a surgical microscope catalog, exemplifies the lack of awareness on this issue. Surgeons are often unaware of their operating position. The optimal cervical angle is around 50 degrees. None of these surgical loops offer a neutral head posture. Lightweight models that cause less than 25 degrees of head flexion are ideal. Slit lamps are often positioned on their tables with a significant gap between the equipment and the operators, causing them to project their heads forward. Bad support for the arm while utilizing lenses, such as in fundus biomicroscopy, poses a potential risk for the shoulders. Standing refractions can require awkward postures for long periods. Inadequate chairs for prolonged sitting and improper selection and positioning of screens and keyboards can cause significant damage to the spine as a whole. Indirect ophthalmoscopy also strains the spine. Lastly, a substantial portion of clinical care involves sitting on stools that may not be ergonomically suitable. Here are a few suggestions for ergonomics improvement. In 1999, Dr. Wallace highlighted proper surgeon positioning and proposed tilting the microscope head to relieve cervical stress. In 2019, Dr. Ziravattseva showed the importance of tiltable binoculars for proper positioning during surgery. The use of devices that provide heads-up position visualization, 3D HUD, can decrease the strain on the surgeon's cervical and lumbar spine, reducing the severity and frequency of musculoskeletal pain episodes. Regrettably, this solution is still very costly. Feet, knees, and hip positioning are very important during surgery, but let's focus on the neck and shoulders. Microscopes for retinal surgery often have too long heads, while the anterior segment ones have heads that are too short. Leica's special tiltable binoculars can compensate for too long heads, but for the short heads, no commercial solution is available. Tiltable binoculars can help, but that alone isn't enough, as it requires elevating the patient's bed too high. Longer focus lens objectives can counterbalance this, but it results in a significant reduction in focal depth. Our solution is a simple tube for the light to pass through, enabling the correct surgeon positioning. 3D printed prototypes were used to achieve the ideal adapter length. Metal versions for both Leica and Zeiss were subsequently produced by a local locksmith. The adapters allow for a neutral trunk inclination position and an ideal cervical angle. This solution is much simpler and cost-effective than the 3D HUD alternatives. All adapter 3D files are available for download on a free 3D file server, allowing any interested surgeon to build these adapters for themselves. The adapters do reduce the visual field by around 20%. However, this is not hard to adjust to in anterior segment surgeries. Surgeons should relax, Our bodies tense up during surgery due to concentration. Listen to your body and do not push through pain. Move. Avoid static positions for long periods of time. Focus on ergonomic practices outside of work also. High-volume cataract surgeons often perform several surgeries without much rest, except for a hand scrub or rub. After our cervical problems, we've incorporated stretching after a number of surgeries. Taking a 10-minute pause to rehydrate and stretch after every hour of work can prove invaluable. To ensure the long-term health of their shoulders and cervical spine, surgeons should consult with physical therapists to develop a personalized stretching regimen and prevent injuries. In the office, there are several ways to improve ergonomics and reduce strain. Shorter slit lamp tables along with light dividers can bring the eyepiece closer to the doctor. The height of the slit lamp and the patient's chair should match the doctor's preference. When using a handheld lens, avoid leaving the arm unsupported. Consider using a station that allows for control of the refractor and optotype screen at a table with the appropriate height while sitting on stools or suitable chairs. Those should have lumbar support and height adjustment of seats and armrests. Use footrests when needed. Adjust the screen to eye level and choose the correct monitor size. For indirect binocular ophthalmoscopy, lightweight and wireless equipment is beneficial. Position the stretcher as high as possible and rotate the patient's head for optimal viewing angles. Saddle stools, commonly used in dentistry, encourage an S shape in the spine rather than a C shape, and are better for the hip and knee joints, which are less flexed. Consult a physical therapist to evaluate your working posture. They can provide valuable insights and suggest any necessary adjustments. It may be necessary to elevate the patient's chair and the refractor stand to use saddle stools. Remember that the upright position exerts less pressure on the spine when compared to sitting. Therefore, incorporating standing or using saddle stools during consultations may prove advantageous. It is crucial to acknowledge the high-risk nature of our profession when it comes to developing WMSDs. In addition to the recommendations in this video, it is essential to cultivate a mindset that prioritizes musculoskeletal health. Embrace an active lifestyle and be kind to your joints. Make regular exercise a priority, with a particular emphasis on strength training, flexibility, and endurance. Let's alter the statistics and prioritize ergonomics to prevent the development of musculoskeletal problems. Thank you for watching.